67,000 deaths worldwide in the past couple months because of a hidden killer. Hi, I'm Mitchell Jones, and this is my persuasive speech on why everyone should partake in social isolation. The main question people ask is, why is this such a problem? I've had the flu before, and that kills even more people, but there are many things that are not understood. For example, there is a vaccine for the flu given out to millions of people every single year, which helps stop the spread of the virus greatly. Also, the coronavirus is a new virus, so there's no herd immunity built up for it over time to help fight it like there is with influenza. Also, the coronavirus transmission rate is much higher. According to the Center of Disease Control and Infection Control, one single person with the coronavirus infects on average 2 other people. This means after only 10 rounds of infection, 1,024 people are already infected with the disease, ready to infect 2 more people each. What is the only way to stop this? Not spreading it in the first place. The U.S. medical care system cannot handle taking care of the amount of people that are and will get sick at this rate. According to Brandon Spector, a senior writer at Live Science and Coronavirus, what is flattening the curve and will it work? It is inevitable that hundreds of thousands of people will become infected. But the goal is to make it so all the infections do not happen at the same time. This is known as flattening the curve. By doing this, hospitals will have enough ventilators and supplies to treat the people that have the virus. This is what has happened in Italy. They had such a very sudden spike in influx in cases, so their health care system, which is even considered to be very good across the world, crumbled. And because of this, Brandon Spector also reports that the death rate in Italy is 7%, which is twice the death rate everywhere else across the world. So as long as we can flatten that curve, much less people will die. But how can we flatten the curve? It's quite simple. Self-isolation. The disease cannot spread if people are not around each other to actually spread it in the first place. Social isolation has been proven to work in countries like South Korea, where after a very sudden spike in cases, it has dropped over time. One main argument people have been saying about why they can go out is that it only affects old people, but this is simply not true. While the death rate in those 65 plus years old and with pre-existing health conditions is much higher, many young people have actually died, including a 30-year-old teacher and even a 17-year-old boy. Also, who would want to get that extremely ill, even if you're not going to experience death? Another belief is that because the amount of cases is low, where some people live, so it is not as bad there. But this is not true. Everywhere that has been hit extremely hard, including places like China, South Korea, New York, and Italy, all started out with just a couple cases of the virus, and it spread extremely fast to much greater amounts of people. So what's stopping it from happening anywhere else? So that is why social distancing and self-isolation is the only way that we can stop the coronavirus to save millions and millions of lives, because otherwise it will continue to spread from person to person and killing countless amounts of people over time.